Tyler, if I told you COVID-19 shutdowns don't have a long-term effect on jobs, what would be your response to that?
My response would be, A, that's got to be wrong, and B, we haven't really had enough data yet on long-term effects after the pandemic on anything to truly know, but I find that hard to believe.
Well, to explain more, we are going to bring in Senior Economist and Communications Advisor for the Upjohn Institute for Employment Research. Brad Hershbein joins us on the show. Thank you for being with us.
Thank you for having me. My pleasure.
For those not familiar with the Upjohn Institute, explain what work you all do there.
Sure. We're an employment research organization. We've been around, nonprofit since 1945. We have an endowment that was started up by the W.E. Upjohn, the founder of the Upjohn Pharmaceutical Company, which eventually became part of Pfizer. So we're mostly independent. We're nonpartisan. We do not solicit funds from donors, for example, so we really are research-driven, and we're dedicated to finding solutions for employment, trying to find good jobs for people, and we are affiliated with the local Michigan Works in Southwest Michigan.
Oh, the beautiful thing is you're right in our own backyard. You're here in Michigan.
We are. We've been in Kalamazoo since the predecessor actually started in the 1930s, but we've been a research organization since 1945, so just in the southwestern part of the state. And we're happy to try to contribute employment solutions to find people jobs.
This is great, and you guys it has to be in a fascinating time for you right now.
It is a busy time, that is true.
Yes. So tell us about this study.
So with a colleague of mine who's actually at Georgetown University, we really wanted to understand how the employment and the labor market was changing, not just in the spring. We know that lots of people lost jobs in the spring. It was very bad. And then the recovery was happening a little bit in the summer. But then there wasn't nearly as much coming out in terms of what was going on in the fall and into the winter, like who was recovering, how were people doing. We know that cases went up and down and mortality rates went up and down, and some states were imposing really severe restrictions. And Michigan was actually one of the states that had longer restrictions for a long period of time. And we clearly know how that played out in terms of politics, and the State House threatened to kidnap the governor. So we made lots of national news for that. But we really don't have a great understanding of how this was playing out in the long run over the course of all of 2020 and maybe a little bit into 2021 of how this was going to presage the recovery. What could we learn about it? And so my colleague and I, we decided to look at the data and try to run a horse race of figuring out that of COVID cases, COVID death rates, and economic restrictions, what were really the things that were most affecting employment in terms of the recovery.
So I have found the numbers throughout this pandemic confusing. They're changing constantly. How do you even start to tackle this topic with the numbers changing as rapidly as they've been changing?
Yeah, the thing about writing this paper is we started it in the summer, and then as we got new data, basically every month, sometimes more frequently, new data were coming out. We had to update things. And we could update it even further. We've gone through the end of 2020 and even the past 7 or so weeks, a lot more has changed. Death rates have come down a lot. Vaccinations have really ramped up. So things are constantly changing. We probably will update it at some point. But by going through all of 2020, we've looked at it longer than most other papers, most other studies that have really been paying attention to how COVID has been affecting the labor market.
Explain to me the restriction index.
Sure. So a bunch of researchers and nonprofits have been trying to track all the different types of restrictions that various states and in some cases localities have been imposing. And they come in all different types. You could think that in the spring there were complete shutdowns, people had to stay at home, to school closures, to restrictions on restaurants and bars, whether they were entirely shuttered, whether they could have indoor versus outdoor dining, group gathering restrictions. So what the researchers did is they basically coded up all of these different types, and then we took that and transformed it into an overall index. And so we really can't separate out the role of restaurant closures versus school closures per se, but we kind of rolled it all together and created an index where 1 was the most severe form of restrictions in the country and 0 was nothing. And so we're really looking at how relatively stronger restrictions played out compared to less severe restrictions.
So when you begin to tackle a topic such as this, do you go in thinking that you're going to have one finding and then get surprised as you go along?
That can definitely be the case, and we did not know what to expect when we started this. I mean, we definitely set out to carefully document how this was playing out in terms of employment and job loss for different groups of workers, by race and education, by the type of pay of the occupation. But then we really wanted to see across states what seemed to be most affecting employment losses and then recovery of these COVID case rates and mortality and economic restrictions. And we did not know what we were going to find. And so we were updating the data, and it turns out that the economic restrictions do matter in the month that they're in effect. They definitely depress employment in the month that they're in effect. But when they get relaxed, and many states relax the restrictions, and then several of them re-strengthen them in the fall, coming into October and November, the economic restrictions don't seem to have a persistent effect on employment. Once they get relaxed, employment seems to come back. That doesn't mean that all the businesses that got affected are coming back. Some cases, people are finding jobs elsewhere. So there are real effects on business closures, and some of them are not going to come back. But employment, people are finding jobs again. But what really seems to matter in terms of depressing employment is mortality. The more people that die, if people are dying more in a month, that is lowering employment that month, but also for several months into the future. And what we think is going on is that when you see a lot of mortality in your state, it gets reported a lot, and you become a little bit shy about going out, about spending money, about doing the sorts of normal economic activity. And if you're not going out and spending as much money, or you're spending it online for a business that's several states away, that's not creating a lot of demand in your own state, in your own area. And when there's less demand, there's less need for jobs. And so that keeps things down.
Brad Hershbein with us here on the MegaCast. He's a senior economist and communications advisor for the W.E. Upjohn Institute for Employment Research. Were you surprised at that outcome?
A little bit, yeah. We did not know what was going to happen going in. I certainly thought that mortality would play a big role based on some theory and some work that has been done in the past. We know that people, because deaths get reported, especially if it's happening not just in your state but in your county, when your friends or friends of friends or relatives get sick and die, that makes it very, very salient. But I didn't know what the effect would be in terms of the economic restrictions. I suspected that they would be negative, but in terms of how long they would last, it could have been equally possible that they did have a prolonged effect on employment. One of the things that we can't look at the same frequency, but we're going to try to look at in the future, is it really affecting business closures? Is it affecting business creation? We know from national numbers and even from some state numbers that even though there have been more business closures over the past year, there were actually a lot of startups too. And so some of the business activity is going to be switching. And that could be across different industries, or it could be businesses using new technologies where you don't have to have as much in-person settings, for example. So that's something that we're going to be paying attention to going forward.
I think back to the beginning of the pandemic, and for some of us that are on social media, and you have large groups of friends but are really acquaintances or people that you don't even know. In some of our cases too, it seemed like in the beginning here in the state of Michigan, so many people were dying of COVID, or knew people who were dying of COVID. And that wasn't the case in Ohio, where they were experiencing something different. So did you look at the impact by state as well?
We did, and one of the things that we found was that the states that got affected more early, the ones that had their first peak in caseloads in the spring, April or May, their effects on employment lingered for a long period of time. And even into December of last year, the states that got affected the first, and it wasn't just, everyone thinks it's the Northeast and Michigan, because we know we experienced it too, but there were several other states throughout the country that also had peaks in April. The thing that seems to have driven that is if you had an airport that had a lot of international flights coming in and out, that seemed to play a big role. So Detroit is a major hub for Delta, a lot of international flights. So we got exposed a little bit earlier. Ohio does not quite have that same level of major airport. So that's one of the reasons why there were differences even for states that are our neighbors. But because we were earlier affected and we did have quite a few people pass away from COVID in the spring, that effect lingered. So even though Michigan, for example, had a lot of severe restrictions that have now, many of which have been lifted as of earlier this month, that doesn't mean that we're going to be in the clear next month and employment's going to come roaring back. We also had a lot of people die, not just in April, but in November, December, and January. And that's going to have be a drag on employment recovering probably for the next several months.
I would imagine, just like you were surprised by one thing, some things are not surprising. The demographics of some of the people that lost their jobs. We know that this really has hit the lower economic tier of our workforce the hardest.
Yeah, and we definitely, and this has been well documented by many other people as well, Blacks and Hispanics definitely had a bigger fall in employment in the spring, and they've had a slower recovery since. It's also been much more severe among lower paying occupations, many of which are in person, things that can't be done remotely. Women were disproportionately affected at first. They seem to be recovering to some extent, but the childcare is still a major issue, particularly if schools are not in person. That is holding back a lot of the recovery. One of the things that we looked at for the race gap in particular was how much of the differential impact for Blacks and Hispanics relative to, say, whites was due to educational and occupational differences. And we find that for Blacks, at least, a lot of it was, particularly in the spring and into about June. But after that, the recovery was still slower, even controlling for those things. So there is something that those racial gaps persist, even controlling for the types of work that they're doing, indicating that there are other barriers that they face.
So, Brad, once you work on a paper and a study such as this, what do you do with this information?
Well, that's a great question. We're trying to share the information broadly so that policymakers and general public are aware of it. We have lots of policy questions about how damaging the economic restrictions are, and I don't want to imply that our study is the be-all and end-all. Researcher will always tell you we need more research because nothing is ever definitive. But it is suggestive that that employment can bounce back. But really, the thing that we want to focus on to have an employment recovery is to keep mortality low. And it has been coming down, and that's great. And vaccinations are beginning to diffuse. But we're not out of the woods yet. And if we start doing away with the social distancing and the mask wearing too soon, especially as new variants of COVID are spreading, the ones that are more contagious, it could come back. And that could prolong the recovery, and more people could continue to lose their jobs, and more businesses could close. So it's a fine line between the restrictions in place. Ideally, we do things that are relatively not so costly for businesses. And mask wearing and socially distancing when possible, even though a lot of people don't like to do it. And I understand too, I have not seen most of my family for at least a year. That in the long run will save both in businesses and jobs and get us closer to the point where we can do those things again.
In the state of Michigan, Governor Whitmer in particular and the Department of Health and Human Services has been very adamant about gradually reducing the restrictions for COVID-19 spread in the state. Have you noticed in this study, particularly in Michigan, but really overall, that there is a difference in economic recovery and job recovery between states that may reduce those restrictions more rapidly and states like Michigan that are extra cautious and very, very slowly reduce those restrictions?
Yeah, there's a bit of a short-term and a longer-term trade-off. So the states that did not even have as severe restrictions or that relaxed them sooner did have faster employment recovery, at least at first. But as the trade-off with that was that they also had a greater number of caseloads and mortality. And so Michigan experienced its big burst in mortality in April, in the spring, when there wasn't a lot of treatment available. A lot of the hospital systems were not prepared, and that's the same with places like New York and New Jersey. Other states that had caseloads peak much later had a bit more time to adapt. And that actually is a fairly important factor that a lot of people aren't necessarily aware of, that if you didn't have your COVID caseload peak until the late summer or early fall, you had several months to plan to build up hospital capacity, to learn about new treatments, not putting people on ventilators right away, for example. And so that played a role in their mortality, but it still came because the virus started spreading more rapidly. And so because in part that you didn't have as many restrictions in place. And so you could have faster employment recovery or less of a decline earlier on. But when the caseloads began spreading more rapidly and mortality started increasing, that's when they took a bigger hit. And so we could kind of trace that out among the groups of states by when their caseload timings peaked. The ones that had later peak loads, they didn't have as much of an employment decline earlier on, it just came later. And then they had to impose restrictions because it was spreading so much. But by then it's kind of too late. And so there will still be this drag on mortality going forward for a few months for them too. So it really is this trade-off of trying to like thread the needle between having a balanced amount of restrictions to prevent as many people from dying, but also not to have so burdensome restrictions that too many people lose their jobs and aren't able to go back to them because the businesses no longer exist.
So where does that balance come into play? Because you did mention what I found interesting was you saying that there is a point where taking these precautions or taking any measures at all is too late. Where in the process do you believe, or based on your study, do you believe that states have made those mistakes where it's had a severe or even just a moderate detriment to the job growth and recovery because they didn't act soon enough?
Some states, there are a lot of southern states that acted particularly late. The Dakotas more recently, in the Midwest. We know that their case rates and mortality in North and South Dakota were just incredibly extreme, among the highest in the country in November and December. More recently, the Carolinas have not been doing so well. California lifted restrictions probably a little too soon and then probably overcompensated more recently as well. So states that seem to have done a little bit better are some of the western states besides California. Washington, Oregon, Utah have all done pretty well in kind of balancing the needle. And other states in the Northeast imposed very severe restrictions, got their caseloads and mortality well under control, and then probably lifted them a little bit too rapidly over the past 2 months or so. And so it really is about trying to find what that balance is. And the interesting thing is that it really doesn't seem to be correlated with politics. Some states with governors who are Republicans or Democrats, both of them have erred. So it really is about trying to pay attention to the science. And going forward, I think more effort needs to be put into place on speeding up vaccinations and encouraging people to still wear masks. As onerous as that is, having your hospital system overflowing and having large fractions of your population die, including a lot of loved ones, is more onerous. And it will lead to fewer jobs and quite possibly a lot of realignment among businesses that'll cause a lot of economic pain. So better to have some discomfort in the short term rather than a lot of economic pain in the long term.
Brad Hershbein with us here on the MegaCast. What were your thoughts when the billboard went up in Indiana naming Whitmer the Indiana Businesswoman of the Year?
There are always going to be some movement across state borders.
I will say, every time I went to Ohio, I was eating out. I was like, I'm eating in a restaurant because I can.
Yeah, my wife's birthday was yesterday, and we ate it in an igloo by ourselves outside. That was our compromise. But I certainly understand that a lot of people are desperate to eat indoors and to have recovery of many aspects of their life. And I'm not saying that's necessarily a bad thing. It needs to be there. You can never eliminate risk entirely, nor should we. It's a balance. It's about taking a calculated risk and what is likely to happen through your own action, not just for yourselves, but a lot of it has effects on other people too. And so a lot of it is just being aware of that if we do go out and if restaurants are at full capacity, that is a risk in which spread could continue to happen. And maybe you don't get the virus, but someone who is at your next door to you, or at least the table right next to you, maybe they get it, but they don't have a bad infection, but they go visit their grandparent and that grandparent does. And so those are the kinds of things that we try to need to be aware of. Everyone needs to make their own risk decisions, but they should try to be aware of what the broader implications of that are. The faster we can get caseloads down and more vaccinations, the more readily we can do those things, and I think without having a sense of guilt. For me, at least, I would feel very, very guilty if my actions resulted in someone else getting very sick or dying. So I try to be careful, but it'll get easier if we can get more vaccinations sooner.
So if someone wants to learn more about the Institute or to actually read this study for themselves, where can they get that information?
So you can go to www.upjohn.org, and a link to the study is on the front page. And so you can read both the full report if you're really brave, or we also have a shorter brief that's about 4 or 5 pages that calls out a lot of the highlights that summarizes the paper.
Well, we so appreciate you doing the work. What are you going to tackle next?
So one of the things that we're also very interested in is that we know that some people are not going to have their jobs come back. And what are we going to try to do to help those people? So we're very interested in additional policies that governments can do, but also a lot of nonprofits and businesses and other organizations can try to do to help people find those jobs faster. And a lot of that actually relates to your previous guest, Dr. Hill, of what programs for worker retraining could help many of the workers try to advance in their careers. And one of the things that Governor Whitmer did do that was first in the nation was to use some CARES Act funding to start up Futures for Frontliners, specifically a program designed to give funding for frontline workers to go back who don't have a degree or a credential, to go back and get one, preferably in an in-demand field, and so that they can actually take a leapfrog in their career. And we're underway to try to study that program, its impacts, and possibly try to provide some additional information to applicants to guide them in paths that look like it's going to have a promising career. We want to see how we can make those programs better.
That's great. I do know a couple people who are taking advantage of that program. If we can help lift one another up, that is a great thing. We so appreciate your time here with us today.
Oh, thank you for having me.
And good luck on that next project.
Thank you very much.
I will say I started to tackle the 48-page study, but I didn't have enough coffee in me yet.
I completely understand.
Brad Hershbein with us on the MegaCast. He's the Senior Economist and Communications Advisor for the W.E. Upjohn Institute for Employment Research, located right here in the state of Michigan.